Hello, my name is Lauren Seda, and I am the Director of Community Services at the Philadelphia Federally Qualified Health Center, and today I would like to discuss the rising issue of food insecurity in our area. In my role at the health center, I work with patients and healthcare providers to identify public concerns and needs within the community. I then partner with various organizations in the state and county to help try and meet those needs. In the past, I have worked to improve the availability of transportation services, dental services, and other specialty services like pediatric and geriatric care. And I have also worked to improve access to health care and basic needs for the destitute. I have recently turned my attention, though, to a growing issue in Philadelphia County: food insecurity. So what is food insecurity? Well, the USDA defines food insecurity as a household-level economic and social condition of limited or uncertain access to adequate food. This limitation can be geographic, which means there's a physical distance and little means of transportation between an individual and an adequate food source, or it may be financial, where an individual cannot afford healthy food. Most times, food insecurity is a combination of both of these factors. When an individual becomes food insecure, they may be forced to reduce meals or go without entirely. This can result in hunger, which leads to poor health, developmental delays in children, and instability in other areas like housing or energy. According to Feeding America in 2014, 69% of food insecure families had to choose between buying food or paying a utility bill. 66% had to choose between food and medical care. 57% had to choose between housing and food, and 31% had to choose between education and food. Without access to nutritious foods, the food insecure may turn to cheap, processed items. These poor food choices can lead to diet-related diseases like obesity and diabetes. Not only does food insecurity cause physical health issues, it can lead to serious mental and emotional issues as well. Families are stuck pondering questions like, when will I eat again? When will my family eat again? Can I afford to eat? And can I afford to feed my family? And how do I feed my family? These stressors can lead to additional health issues. Who does food insecurity affect the most? The most vulnerable populations are senior citizens, children, African Americans and Latinos, the low income, urban communities, and even rural communities. Even though rural communities are made up of the farms where we receive our food, nearly 75% of the communities affected by food insecurity are in rural areas. How do we identify food insecurity? Using an 18-question survey from the USDA, a household may be categorized as having very low food security to high food security. Households with high food security have abundant access to adequate food, where a family with very low food security experience disrupted eating patterns and may skip meals due to a lack of financial or geographic food resources. According to the USDA, 95% of households in the very low food security category reported that they could not afford to eat balanced meals, and 97% reported skipping or reducing a meal because they could not afford enough food. 44% reported losing weight due to food security issues, and 33% reported not eating for 24 hours or more because of little access to food or money to buy food. Food insecurity is a major issue in Philadelphia County. Approximately 1 in 4 residents report issues with food security, and about 325,000 residents go to bed hungry each night. These rates are right in line with the county's poverty rate. And sadly, the rate of food insecurity is on the rise. In fact, food insecurity in Philadelphia County has increased by 9% since 2006, and the county ranks as the 10th hungriest in the nation, according to Feeding America. Food insecurity creates nutrition-related concerns for our community. The World Health Organization says that access to safe and nutritious food is vital in promoting good health and life. According to the CDC, food deserts are areas that lack access to affordable fruits, vegetables, whole grains, low-fat milk, and other foods that make up the full range of a healthy diet. They are often found in low-income areas where families are more than a mile from a grocery store or farmer's market and lack access to reliable transportation. A USDA 2015 census found that more than 18,000 Philadelphians are in a food desert. This is up more than 5,000 from 2010. According to the World Health Organization, nutrition and food security are inextricably linked to food safety. Not having access to safe food sources can lead to a cycle of illness and malnutrition. Those suffering from food insecurity have little choice in food options, which can lead to consuming unsafe foods, like items that have been expired or compromised, and items that were not prepared in a safe manner. These families often suffer from energy security, which means they may not have access to functioning equipment like a working refrigerator or heat source. Per the Center for Hunger-Free Communities, nearly 27% of Philadelphia residents have inconsistent access to an energy utility, which means it is likely that food has been spoiled due to a lack of refrigeration or could not be properly prepared due to a lack of cooking source. A final concern is nutrition education. According to an article from the Society for Nutrition Education, educators feel that food security improves among vulnerable populations when access to nutrition education increases. While nutrition education may not improve resources for food items, it can teach food insecure families how to shop more wisely and maximize the nutritional value of the food items they have access to. The Food Trust is an organization working in Philadelphia and surrounding counties to reduce food insecurity. Their educational program has reached nearly 1.3 million people, and 98% of the adults educated said they would make healthy eating decisions for themselves and their family. As an administrator in the healthcare services industry, it is important that I work with my organization and neighboring organizations to try and address these concerns for the sake of our patients and for the sake of our community. Food insecurity typically occurs when a family cannot access a common food source like a grocery store or farmer's market. This may be because there is not one nearby or because the individual lacks transportation. No one should have to spend hours going to and from a grocery store. This cuts time from where people can be more productive, like at work, school, or spending valuable time with their families. As a director of community services, I may reach out to contacts at the Department of Transportation to see how we can improve bus routes and shared ride programs so that transportation time can be improved in our community. I may also reach out to a food share program to see if we can bring food to the family. We may not be able to get them to a grocery store, but can we set up a marketplace at a nearby school or church? Can we have a farmer's market here at our clinic? And can we coordinate to have food available at a county assistance office or delivered by a social worker? Next, to help prevent foodborne illness, we need to make sure that families are educated on food safety precautions. Maybe we can consider courses in the community, again, at a school or a church. But more importantly, in order to help families be food secure, we need to help them be energy secure. We need to find ways to help families have stable energy sources so that they can keep food stored safely and cook food correctly. We may consider partnering with a representative from the state's LIHEAP program to have them come in once a month and sign patients up for an energy program or an appliance rebate program so that they can have working appliances in their home. Finally, making sure that patients and community members have basic nutrition education and understand the effect nutrition has on their overall health is very important. Can we offer some basic education in the office at an annual exam? Can we create collateral like handouts, pamphlets, fact sheets to hand out in the office and at community events? At the Philadelphia Federally Qualified Health Center, we are going to implement a new initiative in the spring of 2018. To get a better grasp on the food insecurity in our area and among the population we serve, providers will start screening for food security using the 18-question survey from the USDA. Providers at the clinic will be trained on how to properly administer and score the survey, and how to determine the best resources for the level of need. We will also be using these surveys for goal setting and to monitor progress. Based on the level of food security or insecurity, we will refer patients to various resources. These resources include educational courses from the Food Trust, share ride programs for weekly grocery store trips, assisting with LIHEAP applications for energy stability, and coordinating with social workers for more extreme cases. As we develop a better understanding of our community's needs, I will connect with stakeholders at public and private organizations to develop additional partnerships. This may mean reaching out to government representatives to improve government programs like LIHEAP and SNAP, connecting with federal, state, and local departments of health to discuss safety and education needs, and working with private organizations like the Food Trust to expand services. From this initiative, I hope to see a decrease in our rates of very low and low food security, and also to see improvements in the physical, emotional, and mental stress of the patients and community members we serve. If we are able to identify food insecurity here at the clinic and refer patients to resources that can help improve access to healthy foods, safety, and education, then I am positive that we can improve the overall health and well-being of Philadelphia residents. Thank you very much for taking the time to view my presentation, and I hope that you take away some key learnings about food insecurity nationwide and in the Philadelphia area. And I hope that you learn more about what we can do as healthcare administrators to improve this growing issue in our communities. Thank you.